Um, so I'm gonna kind of take you through a little bit of a journey of where I've been, but and what I've come to find out, and what I think it works best to help bring the health into healthcare and helping our communities out. Um, so just a little background on me, just piggybacking off of what my wife said when she introduced me, is that for the longest time I didn't want to be a pharmacist, which to you make you know you don't have any background on that, but I'm actually a fourth generation pharmacist. So I have a lot of background growing up in that area. But my parents own their own business and I never wanted to do that. So I thought I had a nonverbal agreement with my brother to never be a pharmacist because neither of us would ever want to take over our family business. Um, Mind you, down the road, I thought I wanted to be an actor. I thought I wanted to be get my PhD in political science. I thought I wanted to become a lawyer, and all of those things just kind of passed me by. I took all the exams to get into grad school and to do all these different things, but it just wasn't right for me. My brother actually ended up going to pharmacy school first, which it makes sense. He's 2.5 years older than me, but he was already in his upper 20s at the time, and he got me thinking about what it means to be a pharmacist. I'm one of those people that if I see an accident happen on the road, I'll be the first person to stop. I'll be the first person to call 911. I'll be the first one to check on people. It's something that I've been doing since I was a teenager and into my 20s. And if I ever see something out of the corner of my eye that's an accident and I pass it by, which happened one time when we were traveling, I will feel bad about it for months. So it's something that my heart goes out to people, and I just want to be out there and help people. So being a pharmacist really helps me do that. So um, as my background, I spent 5.5 years mainly at St. Vincent's, mainly in the ICU for the last number of years, prior to becoming with Bellin. So I was there in the middle of the COVID. I've been one of 3 people in the ICU room trying to help support patients who are dying from COVID. Only one of 3 people because we got the doctor, we got the nurse doing the compressions, and me helping out with the meds. So unfortunately, I've seen, you know, life at its hardest, both for patients in the community without their families in the room, but also with, just the 3 of us in there. So we keep our the rest of the people who work with us safe so that they're not exposed to the same thing. Um, I've seen some of my colleagues die over the past number of years, also mainly due to COVID, but to other reasons as well. Um, and I've seen, I would say, at least half of the nurses I know in the ICU either leave medical care completely or leave the community just because they were under too much stress. So it's really hard. There's a lot of burnout. And, at first, our nation came together and was really supportive for the medical community, but politics got involved and it kind of transformed into a love-hate relationship, and you just never knew what you're going to go into. For me, it worked out really well. I ended up going over to community. So I have normal business hours for the first time in my life, which is still really weird 2.5 years later. But it works out really well for my family. But having experience both in healthcare inside the hospital and in the community has given me, I think, a unique perspective on our healthcare. A lot of what I'm going to talk about today is mainly healthcare in the community. And the reason is that it's so important to take care of our health in the community to try and prevent the hospitalizations, or at least to make it so that the transition into the hospital is safe, and also that you get the care that you need there too. I do want to tell you that I'm sure I have to do this. My opinions today are my own. They are not the same opinions of my work. And I can tell you that there's definitely some disagreements culturally with what I believe versus what pretty much any medical organization is going to say. So I also want to be clear what the talk is not about. So since I'm a pharmacist, I want to be clear this talk is not about how to get your medications cheaply. Not what it's about. I know I kind of did a little teaser with the healthcare wish, but also the the byline about what this was about. It's also not about the risk of getting health care or lifestyle recommendations from social media. That's a whole nother issue. We don't have a weekend seminar to discuss it, so we're going to avoid that. I'm also not going to talk about healthcare equity. It's a very, very important issue. Um, I think that the steps and my recommendations and what I see can be beneficial for anyone, so it's not specific to any particular group or individual. Um, so what is the talk going to be about? Well, it's going to be about healthcare for the individual. So that means that the recommendations are going to vary person to person. No two people are exactly the same. And so the recommendation should always be different. Um, I'm also going to talk about groups and individuals pushing to slow down healthcare. So it's a very fast-paced industry. There's a lot of pressures to speed things up, make the visits shorter, get more in out of less, which I don't know if you've noticed, it doesn't typically work out well. So there are a number of times that there are other groups and organizations out there that are currently pushing, particularly family practice providers, to consider going in with a half-time position, but actually doubling the length of their patient visits. So they're only getting paid for 50% of the work, but they're doubling the amount of time to spend with their patients. So it, you know, there was, I can't remember which organization it was, but there was that $1 billion donation to a medical MD program in New York, I believe it was, where all of the MD students will be graduating with no loans, completely paid for. So, that does provide opportunity for people who want to go out into the communities and offer support where they don't have all the loans weighing down on them. So there's still a lot of work to be done. But you know, there's a number of organizations that are kind of moving in to try and bring that to the forefront to get more health in our healthcare. I'm actually going to reorganize how I did this. So I'm going to jump down something because of how I want to organize our talk. So I'm going to first talk about the healthcare providers and kind of what they're going through, just to give you a little bit of background and so you can understand the people who try and help you with your medical journey. So how does it look for our healthcare providers today? Specifically in Wisconsin, we have one of the oldest average populations in the United States, and it's just getting older. So we have a lot more need for medical providers, particularly primary care providers. There's a critical shortage expected in all the United States within 5 to 10 years, but we're already there in our rural communities. I'm also concerned about our rural communities. And actually, the organization I work with does have a pharmacist that works in a number of our rural communities. So I'm glad to have that support there. But at the same time, I must admit, I'm honestly not willing to live in the rural communities either. So I acknowledge I'm somewhat part of the problem. I like the opportunities and the privileges that we have here. So I do see patients that drive in an hour plus, some of them over 2 hours just to see the providers locally. I have a couple patients that I see, or at least talk to regularly, that are about that distance away as well. And it's something that utilizing our online resources, video calls, other things, as long as they're able to get fast speed internet to do it in those communities, can really bridge that difference between. Um, Next, for the medical community, we also have pressure from other medical groups themselves. So, there's always a push, since there's fewer since the patient population is getting older and older, we need more and more visits. Well, what is the answer to that? Well, a lot of the groups are like shorter visits. Just get them in and get them out. Bill them for the same amount as we were, which is just not working for them. So there's a lot of corporate pressure. That's how I'd best put it, in order to see more patients, make the group more money. However, we also have the pressure from the patients to try and um, you know, answer all their questions and every single visit. But when you're done with an questionnaire for your yearly annual Medicare visit, and then you get done and you're like, well, you got 5 minutes to see the provider. So make sure you get everything done in that 5 minutes and then they're out of the room and done. It's really, really hard. Um, the other thing is providers have a full schedule of patients. On top of that, they have to respond to all the phone calls that their clinic gets from the patients and the electronic messages. So most of them have to do that, view and respond to all of them by the end of the day. And every single provider I know typically does about another 4 hours of work on their days off in order to just keep on top of things. So they have a lot of work that they're doing. Next, we have pressure from insurance companies. So I know everyone loves their insurance company, right? So one of the um, best examples I have of this is some medical groups, or sorry, insurance companies say if you meet these goals, we'll pay you more, which sounds great. And actually, the data that they're based on is really good data. So I do agree in general that we need to focus on those areas as well. But when we say if you do this, you get paid more, we stop looking at our patients and what they need. And instead we're like, oh, I need to check mark this box. And so it takes some of that decision-making skills out of it. And there should be more, one-on-one interaction and discussing what works best for you. The other thing is, those of you who are in Medicare, if you ever go online, you see those Medicare Advantage plans and their star ratings, the higher the rating, the more money that organization is getting paid. So it's very, very important for them, so much that they pay other people, including sometimes pharmacists, to make phone calls and check, are you still taking that medication? Why haven't you filled it recently? And so again, it's all this pressure on the medical community. Next, we have the pressure from patients as well. Sometimes patients go in and they want one particular medication. This is what they want. And even though the provider is just like, we need to talk through this. I don't think this is the right medication for you. Here is why. Sometimes that, can be controlled medications, pain relievers. I'm not saying that everyone who needs them is seeking, because that's not what I'm saying. It's definitely a needed thing, but it's definitely leads to a lot of pressure. New medications, advertisements. Well, when I watched the Super Bowl, this came on and it said it was going to cure my life. Well, there's a lot of pressure for that, especially when providers feel like they're trying to talk to patients, get through to them. And if we disagree and we say no, it can lead to verbal and written harassment. I've seen it. Thankfully not directed at me, because I don't prescribe, so that means I'm off the hook. But sexism and racism, I've been the white male that our clinicians have used who are female or Indian American, and they're like, can you go in and talk to them? I think you can make the difference. And it's really sad when they've been talking to him for 5+ years and the white male enters the room, talks to him, says the exact same thing. And guess who gets to him? I do. And I don't think that's right. Lastly, I'm going to, for the pressure, we've got all these competing pressures going on. You got the patients, you got the insurance providers, you got the corporate pressures. And so it can be really difficult for the providers to feel like they have enough time to understand their individual patient needs, their priorities, and their health goals. So it can be very, very difficult to, have the time to get to the information they need, to understand it, to process it, to come up with a plan that meets the patient's goals and respects their priorities. Then they have to come back and offer and explain the different options they have for them. And followed by this, then hopefully the patient will agree that one of these plans makes sense for them. And if not, then they need to adjust it. So this should always be a communication back and forth between providers and the patients. Every decision should be the patient's decision. It might come and originate from a healthcare provider, but in the end, the decision needs to be made by the patient, and every patient should have a good understanding of what that decision means. So it is extremely difficult to do well, especially if you have limited time. So what I want to do now is kind of give you a couple patient examples. So these are patients that aren't based on any real life situations. I just kind of made them up, but they do exhibit some of the things that I've seen in my time working. So first of all, I'm going to start with Janet Jacobson. She's 82 years old. She's got difficulty sleeping, has been having dizziness issues. She also has a history of osteoporosis. For those of you who don't speak medical speak, it just means you have very weak bones. You're much more likely to break them if you happen to fall. So Janet doesn't like to bother people. She's a normal Midwest 82-year-old. And so instead of making an appointment to schedule a follow-up with her primary care provider, instead she waits for her annual physical to bring up her issues. As I explained earlier, after filling out and answering all of the yearly questionnaires, she's got 5 minutes left. So she's going to see Dr. Samantha Sohn. Um, so they get done with the physical, and she tries to bring up her issues. Well, the physician says Medicare only pays for our annual review. So we just got to analyze how you're doing today, what's different than last year. And if you have these other issues, we need to make a follow-up appointment. We can't do it today. I don't have enough time. I've got 20 patients left to see today. So she finally admits that she's having enough dizziness and enough trouble sleeping that she'd like to make a follow-up appointment. Unfortunately, it's going to be another 4 weeks until she can get in to see them. It's the earliest that they have an opening. They're willing to put her on a call list, but right now she's got to wait 4 weeks, still dealing with the same issues. Unfortunately, 2 days later, she falls. She breaks a hip. Well, since she broke a hip, she's in so much pain, she goes to the hospital. Well, they can stabilize her, but with how fragile she is, they can't do a whole lot. So instead, she's got to, after they stabilize her, she's got to go to a skilled nursing facility for rehab. Well, unfortunately, she's still dealing with dizziness, which means she can't get up, she can't get around very well. So she's not doing very well at rehab. Um, and since she's not doing well with rehab, she has to stay longer. She can't go home because she can't walk around and she can't do the things that she likes to do. Unfortunately, she's not getting out. She's not seeing her friends and family like she used to. And so her brain slowly starts to decline and she's not, she's not thinking the way she used to. And 7 months later, she dies. This is a very scary situation, and it's actually based on a lot of data. One of the highest indicate a prediction of mortality or death is a broken hip, followed by placement in a skilled nursing facility, especially if they never leave, especially in women. This is the number one predictor of 5-year mortality. And so, it's very important that our healthcare providers take the time to really get to know their patients and to take their and to find the time to meet with them. So I'm going to reverse that. All right. So Janet, instead of seeing Dr. What did I say? Samantha Stone, she is going to see Amos Anderson, a nurse practitioner. It doesn't matter if they're a doctor or nurse practitioner. They're all good in my opinion. So again, she's having sleeping issues, dizziness, history of osteoporosis. So just like last time, similar situation, she waited to our annual physical. So Amos knows Janet though, and knows that she doesn't like to bother him, and always delays talking about her issues until her physical. So when he filled out her appointment time for the next year or 6 months later, depending, he left open another 15-minute block at the end because he knows that she does not like to bring up her issues unless she's already got an appointment. So he hears about her issues and finds out, okay, we need that extra 15 minutes. So he tells his nurse to go ahead and block off the rest of the 15 minutes. And then they take a look, what is going on? She talks about her dizziness that happens all day long, and also her issues with sleep. He thinks that it might be due to the dizziness, might be due to some of the medications that they've tried to help her sleep last time she came in. So he involves his clinic pharmacist, plug in for me, who agrees with his assessment and thinks that the medication might be contributing. So based on their discussion, they go ahead and they discontinue one of her medications, but they also pull back and decrease a dose on one of her other medications. So and then they plan a follow-up phone call for a week later. The good news is the dizziness has much improved. She's able to walk pretty much normally. She does have a little bit of an issue every once in a while, but it's very manageable. However, her sleep is not doing as well as it was. So sometimes we have to take a step back in our medical practice, in our meds, and assess what's going on to take that step forward to find the right thing. So they do discuss what's going on. They identify some sleep habits that maybe she's not doing the best. So they recommend some changes. No new medications, just better sleep habits. 2 weeks later, she's sleeping much better. She didn't fall. And sometimes it's those little differences that can make a huge impact for our patients. So that's just one example. My next example, we have Kyle Kipper, age 42. He's got a new onset of headaches over the past month. He hasn't had a physical in more than 3 years. He works in a paper mill, and his spouse has been begging him to go see someone about his headache because it's just getting on her nerves that he comes home and complains about it every day. So he realizes, okay, it's been 3 years. I can just make a physical because it's free then. So he's going to go see Dr. Sobek. Similar to our last patient, I'm just going to make this one a little bit shorter. Um, even though he's got regular commercial insurance, they also don't pay the same thing when it comes to just a general physical. So this provider also says, yeah, this is your physical. We can take a little bit of time, but we're not going to take much time to talk about your headaches today. And so instead, he's got to, go make another appointment and come back and see them. Well, this makes Kyle really mad. I mean, he went in with this issue that he really wanted to get taken care of, and instead, he just feels like he gets brushed off. So, does he come back? No, he doesn't. Instead, he feels resentful. He may not seek medical treatment in the future when he needs it. And I've seen many patients like this who, the next time we see them, they're being hospitalized for some severe issue. So an example for him is, maybe he just starts self-medicating. Unfortunately, there's a lot of alcoholism in the area in Wisconsin in general. And so sometimes if you're self-medicating with ibuprofen or naproxen, which is Aleve, it increases our risk for having a stomach ulcer and possible GI bleed. And I have seen many patients who have come into the hospital over the years who are drinking a lot of alcohol and they're also taking these pain relievers, and then they have a severe bleed and they end up being hospitalized for a couple days to weeks. And so, when we don't take care of the patients when they meet us, we increase their risk of having further issues down the road. Another example would be acetaminophen or Tylenol. It's a common pain reliever, but it's also the #1 overdose medication and one of the most painful ways to possibly die. Most people don't realize that, but having seen it multiple times over the years, not usually on purpose, it's usually dental infections when you don't have insurance to cover it, is when your pain is so bad that you just keep popping pills, but that can lead to liver failure and other organ issues as well. So we're going to give Kyle a better provider to see. So we're going to see Dr. Durst, and instead, this doctor provides an additional 10 minutes for every single patient. This is not always the answer for everyone, but sometimes having an extra 10 minutes can make a huge difference. So during the physical, Kyle updates her about his headaches. She asks him questions about when it happens, where he is, what part of his head hurts, etc. And he talks about his new manager that started a couple months ago, who said, everything that you're doing, I don't like the way you're doing it. We're going to change it. And so he's got a lot more stress. And so based on when it happens, only during work, surprise, surprise. And actually talking about the situation at work brings on another headache. So based on that, she recommends some meditation, breathing exercise, getting regular exercise, and also spending time outside in nature, particularly on breaks. So if he can get outside, go spend some time away from the paper mill, just between breaks can even help lower his blood pressure and his stress. She also recommends that it's time to probably look for a new position, whether that's in the paper mill he's working or in a different one. I will tell you that I've actually had a couple conversations, particularly with diabetics over the years, that your long-term health is more important than your current job. So if you can find a different one, sometimes that's what decision you need to make. So in the end, he makes a follow-up appointment in a couple of months to follow up on his stress. And then they might need to consider some blood pressure medications as well to help him out if he stays in the same position at the job. So what did we learn? Hopefully I didn't just talk to you guys and all and lose you all. But having adequate time to assess issues often leads to better outcomes. Um, Studies have been shown that if patients feel heard and that they're listened to, that they have better outcomes, even if we're giving them placebo. So it can make a huge difference. Some people just need to be listened to as well. They're not looking for answers. They just want to be heard. And that's one of the things that I believe um why am I blanking on what it's called? But the Surgeon General of the United States was loneliness is such a huge issue. Sometimes people just need to be heard, and sometimes the medical community is the only one that's there. Uh, so, additionally, patients should be involved in their decision making. When patients feel like they have choices and that they get to choose what works best for them, they're much more likely to actually follow through with it. And it leads to much healthier outcomes, less hospitalizations, and they feel happier. So I believe strongly that every patient should learn about their problems, how the problems affect their life, how it works in their body, what they should expect with it, and what treatment options are, how the options work, what are the risks associated with it, how does it line up with their priorities and their goals, how will it help them achieve their health goals. Sorry, now I gotta jump back. So I'm going to talk a little bit about my personal beliefs and how I structure my visits. So I actually am very, very lucky that I get to meet with patients. That is part of my job is I get patients to schedule with me. And I feel incredibly blessed to be able to do it. Um, I don't charge for any of it. So my healthcare system just eats the cost, which I think is amazing. But I get an hour and a half to meet with patients for their first visit with me. So that gives us enough time to really ask questions. What's going on with you? Where are your concerns? Where are your goals? How can we get you there? And then we look at, so the first thing I do is listen. That's majority of the first part is just I listen. I ask a couple questions, what's going on, where are your concerns, and then I want to listen and listen well. So I'll ask clarification questions and then I'll reflect back. So, okay, so it seems like you're really concerned that you can't go out and walk your dog 2 miles anymore. You're down to a couple blocks. Well, what do you think that's from? Are you short of breath? What other things might be going on? Next is to kind of determine options. What do we have in our, in medication wise? But I'm a medication guy, you might think, because I'm a pharmacist. But actually, I'm always going to ask about what's your diet? What exercise do you get? Do you get outside and spend time in nature or not? So it's very important to take every aspect of our life and how it applies to our health as well. And then after I determine some options, we're going to talk through them. I'm going to explain how they work, what they're probably going to do, and if there's any side effects. And then after we go through it all, I leave it up to the patient. Like, what do you think is going to work for you? I hear that this is your biggest priority. I think this probably will fit in there. This will work as well, but I don't think it's going to fit your priorities as well. But you tell me, what do you want to do? So in the end, the patient decides. Um, and then I go back to my provider and I say, this is what we decided. Are you okay with it? And I'll tell you that in the 2.5 years I've been doing it, I've had one time where providers just like, well, I want to meet with them. We've got an appointment coming up in a couple weeks. I want to meet with them first before we do anything else. That's perfectly fine with me. But the rest of the time, I've been able to make all those changes with the patients. So, what can you do? What can you do to make sure that you are getting the most out of your healthcare? So, first off, I want you to find a provider that you feel understands you, respects you, takes your priorities and your preferences in mind when making recommendations. So, this could be someone who takes a little extra time just to listen. Maybe someone who just tells you what to do. Some people don't want to have to worry about things, and that's fine. But I want you to make sure that you trust them, that you feel that they've got your best interests at heart. And some people automatically feel that they trust every medical provider they go into. That's amazing. I don't feel that way, but um, but I want you to. Um, However, it should also be someone that tells you the truth and challenges you to be accountable for the things you can control. Talking about your diet and your exercise mainly, but also getting out there in nature if you know that you're a little bit more depressed and that helps out, that's another thing to do. So how do you find these people? Well, generally ask your friends, family, colleagues in the area, to help identify possible providers. And the other most important part about this step is leave the ones that you feel do not take these into account. So if you don't think that they're really talking your same language, that they're taking your priorities in mind, and I'll tell patients like who've had their provider refer to me and they're like, I'm not really feeling that my provider is really speaking to me the way I want to. I'm like, then go find a new one. Like, not every provider is going to work and talk your language. So you've got to find the one that does. So find one that does, even if that means you're leaving my organization, that's fine. Because I'm more, I want you to have the best health care for you. So next, decide what questions you want answered before you see your provider. Write them down, maybe in 2 or 3 spots, so you actually remember to take one of them. And then make sure that they get addressed doing it. Stay focused when you're there to make sure that you get it addressed as well. If you are not very good at remembering everything that was said during it as well, take someone with you. Take someone who can help be your advocate as well. Very, very important for me and any other medical provider is be honest and open. So if you're not taking a medication that we thought you were taking and your blood pressure is a problem, we're going to either increase it or we're going to add something new. And if you weren't taking it, we're not going to know. So also if we're offering something to you that does not work based on your priorities and goals, then let us know, because there's no reason for us to go down that road if you're not going to do it. And lastly, advocate for yourself. In all things, advocate for yourself. Or like I said, bring someone else who can advocate with you. It's your health, it's your life. And the best thing you can do is make sure that you're standing up for yourself. So in summary, it can be really difficult for the healthcare providers to get through all the different pressures and challenges facing them. And it doesn't make it any easier on you in getting the healthcare you deserve. So I encourage you to evaluate your health and the providers that you see and answer the question, are they the right fit for you? And if not, go through those steps that I kind of talked about. Assess, find some other options for yourself. Because in the end, it's your life and your health. And we want you to live the best, highest quality that you can get. Thank you.